Hi, my name is Grace, and today I'll be inserting a Foley catheter. The first thing I'm going to do is I'm going to check my provider's orders, where I see that there is an order for Mrs. Charlene Knight to insert a Foley catheter, as it says the patient has urinary retention and is unable to urinate. So I will now go into my patient's room. Knock, knock, knock. Hi, Mrs. Knight. My name is Grace, and I'll be your nurse today. Can I please have your name and date of birth? Okay, Mrs. Charlene Knight, August 8th, 1939, thank you. And I see here that you're allergic to penicillin, latex, and betadine, so I'm going to make sure that that matches the order. So I hear that you've been having urinary retention and you haven't been able to urinate, so there has been an order for a urinary catheter for you. And before we insert that, I want to go ahead and assess the site and just make sure that there's no reason to not insert that. So I'm going to go ahead and perform hand hygiene. And put on gloves. And then I'm going to go ahead and I'm going to put the sheet down. Go ahead and lower your bed just a little, and then I'll go ahead and I'm just going to visualize the urethral meatus and check for any abnormal lesions or discharge, and it looks very clean. I know the aide performed care this morning, so that looks good. And then I'm just going to go ahead and I'm going to palpate the bladder and check for tenderness or distension, which I do note distension, but that's expected with the urinary retention. So other than that, Mrs. Knight, I don't see anything that wouldn't allow us to insert the catheter. So I'll be right back. I'm going to go ahead and set up the supplies for that. Okay, so now that I'm back at my orders, I'm going to go ahead and I'm going to check the catheter with the orders, which I see that there is a 14 French Foley catheter, and that does match the order. I also see that there's nothing in it she's allergic to, and the catheter is not expired, so that's good. I now want a clean and dry workspace, so I'm going to make sure that the provider's orders are off, and I'm also going to make sure that everything's at my waist level. And I'm going to make sure that the package is intact, which this one's not because I have used it for practice, but normally I'd make sure that the package was intact. So I'm going to go ahead and I'm going to open that, and I'm going to take out my catheter, and I'm going to go ahead and set my plastic bag up as a trash bag at the edge of the bed for later use. And then I'm going to go ahead and I'm going to set Mrs. Knight into the correct position for the procedure. Alright, there you go, Mrs. Knight, that's perfect. Okay, and now I'm going to come back to my catheter and I'm going to perform hand hygiene before I begin my sterile procedure. So the first thing I'm going to do is I'm going to open all of the flaps, and I want to make sure that when I do this I'm never reaching over my field and that I'm staying within the 1-inch margin. So I'm going to go ahead and I'm going to grab the 1-inch margin of the top flap. I'm then going to grab the 1-inch margin of the side flap, and then I'm going to open the other side, and lastly I'm going to open the bottom, and I'm going to go ahead and only touching the 1-inch margins and not reaching over. I'm going to reposition so that nothing's hanging off. I'm now going to go ahead and grab my blue drape on the shiny corner within the 1-inch margin, and I'm going to step back and I'm just going to go ahead and open that, again only touching the 1-inch margin and keeping everything above waist level. And now as I drape this, I want to make sure that I'm keeping my sterile field in view and not turning my back to it. So I'm going to go ahead. I'm just going to drape this under my patient. And I'm just going to pull within the 1 inch margin so that's a little bit closer. I'm now going to come back to my field and I'm going to grab my gloves and I'll bring them to the edge of my table where I have more space. And I'm just going to go ahead and I'm going to open this. And I'm going to make sure that I'm only touching the 1 inch margins of the inside of this. I'll fold it up just a little so it doesn't fold back in on me. And then I'm going to go ahead and I'm going to grab with my non-dominant hand the inside cuff, and I'll grab that, I'll step back and I'll just kind of reposition it. Again, only touching the inside of the cuff. And then I'm going to go ahead and with my hand above waist level, I'm going to supinate my hand in. I'm now going to take the 4 fingers of this. With my thumb out, I'll grab the inside of the second glove. And then I'm going to go ahead, step back, and once again, with my thumb out so that I'm not doing that. Okay, and as you can see, I did miss my fingers, but I now have sterile gloves on, so I can carefully reposition this. And pull down. Alright, and I did not break sterile procedure. I'm now going to grab the inside sterile part of this and just throw that away. Now that I'm back, I'm going to go ahead and I'm going to grab my white drape, and now everything is sterile. My hands are sterile, so sterile can touch sterile. And I'm going to go ahead and I'm going to open that, and I'm just going to drape this over my patient. Okay, and now I'm going to grab the hydrogen peroxide and I'm going to spray that over my cotton balls. Next I'm going to take the lube and just put that in the corner of my box. And now I'm going to reposition my box. Once again, sterile can touch sterile. And I'll just set that right there. But I am going to make sure that I'm staying within, or not letting anything touch the 1 inch margins. Okay, and now I'm going to go ahead and I'm going to pick up my syringe, which I see has 10 milliliters of sterile water. I'm then going to find the green cap of my catheter, and I'm going to note that the balloon holds 5 to 10 milliliters, so that matches. So I'm going to go ahead and hook that up and just place that back in the box. And now I'm going to go ahead and I'm going to take my catheter and I'm going to take the sheath off of that, using 2 hands to support it so it doesn't fall off. And then I'm going to go ahead and I'm going to put the tip of that in the lube, which will just ease the insertion later. And then I'm going to go ahead and I'm going to take this specimen cup out. I won't need that. And now I'm just going to go ahead and grab my tray, and I will pick up my box and I'll be moving this over to my patient. This is no longer important, and I'm just going to drop my box onto by my patient, and this is now my primary focus, and this is my entire sterile field. So I'm going to now purposely contaminate my non-dominant hand so that I can hold open the labia, and I'll be keeping this here for the remainder of the procedure. I'm now going to take my forceps and I'm going to clean the vagina, beginning with I'm going to be wiping from clitoris to anus, and I'm going to wipe outer, go around my sterile field, throw it away. Inner, around my sterile field, throw it away. Middle, around my sterile field, throw it away. And then on the other side, outer, around my sterile field, throw it away. Inner, around my sterile field, throw it away. And one more time, the middle, around my sterile field, and throw it away. And I'm now done with the forceps, so I'll throw those away as well. And I'm done with maturing, so I can throw that away as well. I'm next going to take the tip of the catheter 2 to 4 inches down so that my fingers won't be touching the urethral meatus. And I'm going to tell Mrs. Knight, you are going to feel some pressure, so if you could bear down. I'm now going to insert the catheter. So I'm going to find the urethral meatus and making sure to not let the catheter touch and making sure my fingers don't touch. I'm going to insert that in, making sure that I don't feel any resistance. And when I see urine, which I do, I'm going to go ahead and I'm going to insert it 1 more inch. And then I'm going to hold it as I inflate the balloon. Okay, and in this case, my catheter is not in, okay, my catheter isn't in the bladder. It's actually still too far back, so I would just go ahead and insert it a little bit more. And now I would insert that. Go ahead and take off my syringe, give it a little tug to make sure that it's still in there. And now I'm done with my sterile procedure, so I would go ahead and I would attach the bifurcation to the patient's inner thigh and the bag to the bed where it doesn't move. And I would go ahead and ask Mrs. Knight how she tolerated the procedure, and I would document accordingly the input and output, the characteristics of the urine, the type of catheter, and the size, as well as how Mrs. Knight tolerated the procedure and the reason why she had the insertion. And then I would tell Mrs. Knight that we will be performing catheter care every shift. I would then take off my gloves and I would perform hand hygiene.